Okay. So let us start with 3 Om recitations and prayer.
1 minute. Start.
Okay. Please sit straight, adopt Dhyana Mudra. Chin parallel to the ground. Gently close your eyes. Breathe in. Out. 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 Please join your palms. Prayer to Sage Patanjali. योगेन चित्तस्य पदेन वाचा मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि आबाहुपुरुषाकारं शङ्खचक्रासिधारिणं सहस्रशिरसं श्वेतं प्रणमामि पतञ्जलिम्. हरि ओम. Okay. As I had mentioned in yesterday's session, we will start decoding each and every system, but in short, so first we will start with musculoskeletal system. Okay. Is it visible properly? Okay.
Yes, ma'am.
Yeah. First of all, we will go through the skeletal system. Now, in last session, we saw some of the functions of skeletal system, how human body gets formed, and different systems, they are working together in coordination. So first system is skeletal system. It is made up of bones. This is very simple. The bones in the body join together to form the skeletal system, and they are giving our body shape. And now the human skeleton shows various bones in their normal position. It is composed of 270 bones at birth. This total decreases to 206 bones by adulthood. So, Divya, you were close yesterday. Like, I think you told 207.
108.
8. Okay, so 206 bones are there in human body. Now, to study this skeletal system systematically, it is divided into two parts: axial skeleton and appendicular skeleton. You can see here axial skeleton and appendicular skeleton. Okay, so what is axial skeleton? Axial skeleton is made up of skull, ribs, and vertebral column. Skull, ribs, and vertebral column. Right? And appendicular skeleton, it forms extremities like upper extremity, 2 limbs of upper extremity and 2 limbs of lower extremity, hands and legs. That is called as appendicular skeleton. So appendicular skeleton is connected to axial skeleton, and axial skeleton is central part of the skeleton. Right? Skull, ribs, and vertebral column. Is it clear? Now one by one we will see. First of all, we will go through all the names of the bones. So right here, you can see axial skeleton consists of skull, ribs, and spine or vertebral column.
Just expand it, madam. Make it to 100%. Still more. Yeah.
Okay. And appendicular consists of upper and lower limbs plus bones forming the girdles that we will see what is girdle and how it is connected to axial skeleton. Now, 5 basic functions of the skeletal system: offers protection of vital organs, stores essential minerals, produces red blood cells, provides structure and shape for the body, enables movement. Spine is divided into, we will see one by one actually. So, axial skeleton, first you can see here cranial bones, skull or brain box. It has 8 cranial bones and 14 facial bones. So no need to memorize all 14 names of facial side, but 8 cranial bones, of which brain box is made up of, and in this cranium, brain is situated or located. Now, this cranium is made up of 8 bones. If possible, try to memorize the name: frontal, yellow colored; parietal, temporal, occipital, sphenoid, and ethmoid. Frontal, parietal, temporal, occipital, sphenoid, and ethmoid. 8 cranial bones. Just, I know memorizing names, anatomical names is little bit difficult, but still, once you will just go through all the names again and again, it is very simple to memorize, right? Then next part of axial skeleton is ribs. How many ribs are there in our body? There are 12 pairs of ribs. Total 24 ribs are there. Ribs are divided into true ribs, false ribs, and floating ribs. Lungs and heart, 2 vital organs, are located inside this rib cage, and rib cage is protecting those organs, right? Now, true ribs are number 1 to number 7. False ribs 8 to 12, and 11 floating ribs, false ribs are 8, 9, 10, and 11, 12 are floating ribs actually. But some of the books, they describe false ribs as 8 to 12, right? So you can see here true ribs, false ribs, and floating ribs. Why? Why it is called so? Because true ribs are connected to sternum. Sternum is this middle bone, chest bone middle. True ribs 1 to 7, they are connected to sternum anteriorly and posteriorly to the thoracic vertebrae. False ribs, they are connected to each other and last true rib. And floating ribs are only posteriorly attached. They are not attached to the sternum. They are just floating here. Green color and violet color you can see. So this is how rib cage is made. And our 2 vital organs are situated in that rib cage, right? So it is clear now. First, cranium, 8 cranial bones. Skull is made up of that cranial bones and facial 14 bones. So 14 bones we are not going to memorize or go through. It's very vast actually, but you can remember or memorize 8 names of cranial bones, structure of ribs, and then last part of axial skeleton is vertebral column. It is made up of 33 vertebrae. So you can see each and every vertebra. Now this cervical region or upper part, upper 7 vertebrae, they are called as cervical vertebrae, 1 to 7. First is called as atlas, C1 atlas, C2 is axis, C2 is axis, and remaining 3, 4, 5, 6, 7. This part is called as cervical vertebrae. Then thoracic 1 to 12. 1 to 12, thoracic vertebrae. Lumbar, 1 to 5. Sacrum, total sacrum or sacrum, it is fused bone. 5 vertebrae, they are fused together. And coccyx or coccyx, 4 vertebrae. So total number is 33. But if we will count this sacrum and coccyx 1 fused, then we can minus 33 minus 9. Right? So that is how our vertebral column is made up of irregular bones called as vertebrae. Vertebra singular, vertebrae plural. Right? So axial skeleton is clear. Now we will go to appendicular skeleton. Appendicular skeleton, bones of hand, bones of legs. So you can see here, is it clear? Image is clear? Okay. Appendicular skeleton or our upper and lower extremities are attached to axial skeleton through a structure. It is called as girdle, shoulder girdle and hip girdle. This point where bone of arm, upper arm, called as humerus, is attached to scapula. This point is called as shoulder girdle. And in lower extremity also, where humerus is attached to hip bone. So hip girdle. And through this girdle, the extremities are attached to axial skeleton. Okay. Now, upper extremity bones, arm bones. This is clavicle or collarbone. Then scapula. It is located posteriorly on upper back area. This is humerus, radius and ulna. So radius is located laterally, means where our thumb is there, doctors check radial pulse. Where doctor check our radial pulse, in that lateral side, radius is located, and in medial side, ulna. Then bones of hand, carpals, bones of wrist, metacarpals and phalanges. So number of carpals are 8, metacarpals 5 and phalanges total 14. 8, 5 and 14. Carpals means wrist bones. They are small irregular bones attached to each other. Then metacarpals means our palm region. It is formed with 5 bones. And then phalanges, fingers. So 3 each in each finger and 2 in thumb. 3 in each finger and 2 in thumb. So total number is 40, right? So bones of upper extremity clear. Now bones of lower extremity. This is called as pelvis. 2 hip bones together, they form basin-like structure. This is called as pelvis. Now, this humerus or largest bone of our body, it is attached to this hip bone. Okay. Now, below humerus, tibia and fibula. Tibia medially, fibula laterally. Tibia on inner side, shin bone. We called it as shin bone. And laterally, fibula. And then again, tarsus. Tarsus, like we saw in hand, there are phalanges, carpals, phalanges. So like that, 7 tarsals, 5 metatarsals, and 14 phalanges. Okay. Is it clear? So names are a little bit difficult to memorize, but still it is not that difficult. So just go through it again and again, and you will find it simple. Bones of the upper limbs: clavicle, humerus, scapula, ulnar radius, carpals 8, metacarpals 5, phalanges 14, and sternum. Sternum means that chest bone located middle side of ribs. Ribs are attached anteriorly to the sternum. Now it is clear. Now bones of lower limbs: femur, tibia, fibula, patella, tarsals 7, metatarsals 5, and phalanges 14. That's it. So we saw all bones of our body. Next, types of bones: long bones, flat bones, irregular bones, short bones, and long bones are found in the arms and legs. Like just now we saw humerus, isn't it? It is long bone. Tibia, fibula, it is long bone. Femur, longest bone. Then flat bones, skull, all cranial bones. Hip bone, irregular bones, vertebral column. Examples are very simple. These are the types of bones. Is it clear? Now, joints in the human body. Joints is also, this is also important part to understand, and how joints gets formed in our body, that we should know. There are components of joints. It is also called as articulation. For articulation or formation of joint, which structures are involved or components are there? First of all, 2 or more than 2 bones, cartilage, ligament, synovial membrane, and tendons. These 5 major components are there. They together form joints in our body. Clear? What is cartilage? Bone we all know. Bone we saw. Now, types of bones and names of bones. Cartilage is a smooth elastic tissue. Yesterday we saw what is tissue. So cartilage is smooth elastic tissue, and it is actually rubber-like padding that covers and protects the ends of the bone, long bones. So ends of the long bones are covered and protected by cartilages, and it is elastic tissue. Then ligament. Ligament, it is very much famous nowadays because many people, they are having ligament injuries. So ligament are bundles of white fibrous tissues. So the ligaments are very strong. They are flexible actually, but inextensile, means we cannot, it is not like rubber band. We cannot stretch. They are strong, but if we are stretching them more than their limitations, we are crossing the limit, then it is going to, injury is there. So like that, ligaments are strong structures and they form bones together. They keep joints in stable state. Then synovial membrane, it is also very much required to provide lubrication. Synovial fluid is provided by this synovial membrane. Next is tendon. Tendons are tough parallel bands of connective tissue. It is all tissue, and they are giving support to that joint, and they help in movement of that joint, right? So these very important components, they form joint together. Types of joints: fibrous, cartilaginous, and synovial. So these are anatomical names. You can just memorize or remember it, like immovable, semi-movable, and freely movable. So fibrous are immovable joints, cartilaginous are semi-movable joints, and freely movable are synovial joints. Fibrous joints, example of fibrous, you can see here, cranium, our skull bones or cranium, bones of cranium, they are fixed to each other. They are not movable. They are forming that box to protect brain. So example of fibrous joint is cranium, cranial bones. Then cranial bones forming together, that cranium. Cartilaginous are semi-movable. So semi-movable means our vertebral column. We saw vertebrae are sitting on each other, but while we are they are allowing movements like forward bend, then twisting. So these are semi-movable movements. So vertebral column is the example of cartilaginous or semi-movable joint, type of joint. Then synovial is freely movable. Knee, you can see here, hip joint. Then shoulder joint. Those are freely movable joints. Now, synovial joints are again you can see types of synovial joints. Now it is visible. Yeah. Ball and socket joints allows movement in all directions due to the ball-like end of one bone fitting into cup-like socket. Shoulder joint. How shoulder joint is there? It has socket and ball. Head of humerus, it is sitting or getting fixed in socket of that. We saw upper backbone, scapula. So there is a cavity of scapula. There it is connecting. Now hinge joint allows unidirectional movement like the ones in the knee and elbow. Hinge means unidirection. Our elbow moves in this direction only, in one plane only. This is called as hinge. Hinge of door. Door opens in unidirection, like that. Then gliding joint allows the joint forming surface of bones to glide over each other. Carpal and tarsal bones are wrist joint. There are 8 bones we saw, carpals. They glide on each other, and so this movement is happening. Pivot joint, it is the type of joint which allows only rotational movement. One end is fixed of that joint and other end, like skull, is sitting on atlantoaxial joint. So at first and second cervical vertebra. Remember that we saw already. So all pivot joint and then condyloid joint and saddle joint. Both are same, but their range of motion is little bit of difference in range of motion. Condyloid is the type of joint which allows angular movement. So wrist joint, angular movements, and saddle joint, first carpo-metacarpal joint. So like thumb is moving in this direction. Their structure is very interesting. Afterwards, you can go and Google the photos. It's very interesting how it is moving. So saddle joint, condyloid joint, and pivot joint. So ball and socket, hinge, gliding, pivot, condyloid, and saddle. These are the types of synovial or subtypes of synovial joint. So here you can see pivot, one end is fixed, and arrows, they show their rotation direction. Hinge, condyloid, ball and socket, saddle, gliding. One more chart is there. Just now I had mentioned about examples, ball and socket. Example, femur and acetabulum of pelvis, shoulder, scapula, and humerus. So you can go through it. Now next is directional terms. Whenever you study anatomy and whenever you study especially skeletal-muscular system, you should know the directions, certain directional anatomical terms. So we will just go through it because in future you are going to hear all these terms every now and then. In maybe asan, biomechanics, it is related with anatomy, biomechanics of asan, etc. So anterior or ventral describe the front or the direction towards the front of the body. So toes are anterior to the foot, that is anteriorly, front direction. Then it is also called as ventral. So this, what we are seeing, front part, that is called as ventral. Then posterior, back. Posterior is back, describes the back of the direction. It is also called as dorsal. So ventral, dorsal, anterior, posterior. Superior, superior is cranial. So cranium is located superiorly in upper part. So cranial describes the position above or higher than another part of the body. Inferior or caudal. So cranial and caudal, new terms for you. So caudal describes a position below or lower than the another part of the body. Lateral, I had mentioned while describing tibia, fibula, ulna and radius. So radius is laterally, ulna is medially. So lateral describes the side or the direction towards the side of the body, away from the body. And medial describes the middle or the direction towards the middle of the body. Then proximal describes a position in a limb that is nearer to the point of attachment or proximity. Then distal describes the position in the limb that is farther away from the point of the attachment or away from the body. That is distal. Superficial and deep. Superficial is surface, near surface, and deep is deep inside. Deep is, now we know what is deep. The brain is deep to the skull. That is the example of deep, right? So these are the directional terms we should know. Till now, any questions? Clear what we saw? Okay. So skeletal system, axial and appendicular. Axial is made up of skull, rib cage, vertebral column. Appendicular, bones of upper extremity, bones of lower extremity, pelvic girdle, hip girdle. It attachment point. Then types of bones: small, long, flat, irregular. Joint, components of joint: bone, cartilage, ligament, tendons, synovial fluid. Types of joints: fibrous, cartilaginous, and synovial. Subtypes of synovial joint: ball and socket, hinge, plane or gliding, pivot, condyloid, and saddle joint. Right? And we saw examples of each and every joint. Now, next is muscular system. What is muscle? Muscles are specialized tissues which can convert chemical energy into the mechanical power and force. Like yesterday we saw movement and locomotion. Movement and locomotion is the major function. And how this movement and locomotion happens? Because of muscle contraction. So what muscles are doing? They are converting chemical energy into mechanical power and force. And we are getting this energy from mitochondria. We saw cell and parts of cell. So that energy in the form of ATP, ADP and everything. So we are getting, and muscle tissues are converting it into mechanical power and force. Now muscles are voluntary and involuntary. Voluntary are skeletal muscles, involuntary cardiac and smooth muscles. That we know. Now next is basic muscle anatomy. So some of the terms commonly used in muscle anatomy. The muscle fiber, we find in muscle fiber, we find two types of proteins, actin and myosin, sitting in a long row. Skeletal muscle is made up of muscle fibers actually. There are multiple muscle fibers, and those muscle fibers, on each and every muscle fiber, there are proteins called as actin and myosin sitting in a long row. These proteins are waiting for the nervous system to send a signal that will release calcium. So how muscle contraction happens? Two proteins are responsible, actin and myosin. How it happens? Nervous system sends a signal, and after sending that signal, calcium ions, they get released, and because of that, the actin and myosin, they getting attracted towards each other. Sitting on muscle fiber, they start getting attracted towards each other, and that's how the muscle contraction happens. Each and every fiber starts contracting. In short and in simple words, otherwise the chemical procedure is very vast, but in short, actin, myosin, proteins and calcium ion is responsible factor for muscle contraction and movement. Is it clear? Now, functions of muscles: stabilize body positions, produce motion, store and move substances, generate heat. Properties: contractility, ability to shorten, just now we saw, extensibility, ability to lengthen, elasticity, ability to return to its normal tone. After that procedure is over, it returns to normal tone. Electrical excitability, respond to nerve impulses. Just now we saw that when brain gives command, then this whole procedure starts. And how it starts? Because of muscles are having that electrical excitability. Neuromuscular junctions are there all over the body. So they are connected with nervous system, right? Now types we saw: smooth, cardiac, skeletal. Characteristics: more stable proximal bone where the muscle starts. Insertion. So these are all characteristics of skeletal muscles. Skeletal muscles are covering our bones. So there are 2 points where they start and where they insert, or they are attached to bones. So there are 2 points and they are stable and very fixed to that specific bone. And where they start, it is called as origin, and where they insert, it is called as insertion on the distal part of the bone. And their functions are muscle contraction, movement of body, locomotion of body. Next is muscle can only pull, exert a contracting force that cannot push. You will understand when we will discuss about muscle contraction, then you will understand, because contractibility is the major function of muscle fibers, skeletal muscle fibers. A muscle crosses at least one joint. This is demonstrated when the muscle contracts or shortens, bringing the bones closer together. Biceps, triceps, example. They are crossing one joint, elbow joint. When I am this flexion, or I am taking my hand towards my shoulder, his bicep is shortening and tricep is lengthening. So this movement we are going to see in next topic is that only types of muscle contraction, but that is the very important characteristic of skeletal muscle fiber. Muscles usually work in pairs. Right now, I gave you example. So pairs means bicep is shortening, tricep is lengthening. That's how it works. Now, more detail. Muscle contraction, types of muscle. First of that, I just forgot to mention the contracting muscle is called as agonist and relaxing muscle is called as antagonist. So they are supporting each other. If this is not lengthening, this movement is will become very difficult for my elbow or my elbow joint, because it is called as range of motion. In this plane, I can take my hand towards my shoulder. I can put fingers on my shoulders because of this flexion or range of motion of my elbow joint. And it is happening just because bicep is contracting, tricep is lengthening. So agonist and antagonist movements together responsible for range of motion, movement of our joint. So when we want to improve our range of motion of a joint, we have to work on this muscle contraction and stretching. Stretching is another part that I will describe, explain in short. So isometric contraction. Iso means same, metric means length. The length of muscle fiber is same in this type of contraction. This is a contraction of a muscle with no movement involved and it serves as stabilizer. Means length is not going to change when muscle contraction is happening. It is called as isotonic. Isometric. Metric means length. Isotonic, concentric. Now the muscle contracts and shortens. So in this type of muscle contraction, tone is same, but muscle is shortening in length. The distance between proximal and distal or origin and insertion of that muscle fiber is reducing. And isotonic eccentric, the muscle contracts and lengthens. Lengthening is there. So muscle contracts but lengthening. The distance between two ends getting longer, like in Paschimottanasana, quadriceps and hamstring. Just try to think about it. This is homework. No, but this example I have already mentioned in next slide. So I will give you one more asana. So try to understand movements whenever that you are performing that asana. Which muscle is getting involved, which muscle is getting reducing in muscle fiber, reducing in size and lengthening in size. So Trikonasana. Try to just, this is homework, just a brain game de rahi hu. Just try to find it out. Which muscles are getting involved, which muscles are shortening, which muscles are lengthening. Okay. This is again, we saw this already, types and no need to memorize or all these muscles names. This is just for your additional information. So contraction in detail. Every muscle is having its opposite muscle. Bicep, for bicep there is a tricep. I had already explained, but I put this slide also here for you so that no need to write it down. Then that is basically attached from opposite sides of both. So when one muscle is contracting, the other remains relaxed and allowed to stretch so that movement is possible. Now this idea is clear. Movement is possible because it is relaxed. If the opposite muscle is not allowing to stretch, it means the resistance is created which limits the range of motion. Clear? It is not allowing, so range of motion is not there. Thus, during motion, the muscle which is contracted is called as agonist and muscle opposite is called as antagonist. We are repeating so that it will be easy for you. The type of contraction in which the muscle length is reduced and leads to motion is called isotonic, and the type of contraction where the length remains as it is but muscle bulk becomes hard is isometric. More clear. Now idea is more clear, right? So muscle tone is the continuous and passive partial contraction of the muscle at rest, which helps to maintain the posture. Muscle tone का idea क्या होता है? What we think whenever someone asks what is muscle tone, we think that okay. Sorry, my internet connection got disconnected. Can you hear me? Okay.
Ma'am, now we can hear. In between we couldn't.
Okay, yeah, because of electricity down. Okay. So now idea of muscle contraction is clear. Okay. We were talking about muscle tone. So whenever we talk about muscle tone, we think like its bulk or which we see, for example, Salman Khan. So that is muscle tone, but it is not that. Muscle tone is the continuous and passive partial contraction. So at rest also, muscles are in passive contraction so that it becomes easy for movement. If I am sitting here and something comes towards me, any object with speed, so when I saw, I am able to dodge that object, whatever trying to hit me, because my muscles are in partially contracted position and they can shift, they can contract and they can shift your body. So this movement they can perform. So this tone is continuous and passive partial contraction of the muscle at rest. And because of that, we can sit upright. Back muscles, chest muscles, core muscles, they are in contraction. That's why we can sit. Otherwise, just imagine if that passive contraction in muscle fibers is not there, what will happen? Loose muscles without hypotonic muscle. So some of the pathological conditions in abnormally hypotonic muscles, that symptom occurs. So that is pathology, but this is normal muscle tone. Clear? Okay. Now stretching. Stretching of muscle, whenever yoga asanas we perform, we do lots of stretching also. So stretching is a passive phenomenon. There is no motor signal to stretch the muscle. Skeletal muscles are voluntary as well as we know skeletal muscles are voluntary in nature. So once the stretching, this phenomena starts, it can happen independently or by the force of external things. We can take support if we are trying to practice middle split. So we can take force or we can assistance. We can get assistance or external force. So smooth muscles, they are very good in stretching because expansion of stomach after food intake, that happens automatically. Stomach full with food. So stomach bag or muscles, they can stretch. Then uterus during pregnancy. That stretching is also, involuntary and body itself adapts and compensates As fetus grows, muscles of uterus, they start stretching. And with that, abdominal muscles start stretching. And then stretch marks. That is the further thing, but still. And regular stretching improves flexibility. Flexibility is the range of motion of the joints. We already saw range of motion depends on agonist, antagonist, their coordination. And to improve this range of motion, we should practice stretching regularly. Otherwise, what happens? Many times the muscle remains contracted at rest due to chronic stress or lack of exercise. Generally, we see this area, neck and shoulder area, lots of people, they just pull this area, their, what is it is called? Shoulders. They pull their shoulders like this and continuously they stay in this position. It is because of chronic stress. Automatically, muscles, they become used to of it, this for this position. So, and they remain contracted. They remain contracted because of stress and lack of exercise. That muscle does not allow movement. While practicing Paschimottanasana, quadriceps contract strongly to extend the knee. You both of you know how to perform Paschimottanasana. We sit, we with legs extended and we bend forward. While bending forward, knees are supposed to get extended properly. To adopt that extension, quadricep is the muscle which is there. That muscle is contracting strongly here to extend the knees. At the same time, the hamstring should be stretched significantly to complete that knee extension. But most of the time, what happens? Hamstring stiffness, most of the people, they are experiencing that because of lack of exercise or any other conditions. So if hamstrings are very much contracted and they're not allowing that stretch properly, so even if quadriceps are doing their job properly, that extension does not happen, knee extension, right? So that is the example of stretching, proper stretching and coordination of agonist and antagonist. Like here we saw bicep and tricep. While practicing Paschimottanasana, quadriceps is a muscle group which is anterior thigh muscles, and hamstrings, posterior thigh muscles. They work as agonist, antagonist. But if posterior thigh muscles or hamstrings, they are not allowing proper stretch, then quadriceps are not useful in this whole Paschimottanasana practice. Now it is clear. So how to apply this knowledge? Like we saw muscle contraction, we saw types of muscles, we saw functions of muscles, but you should know how to apply this knowledge on in yogic practices. So I gave one example to you. So this is all about our skeletal-muscular system. If there is any question or any topic I'm missing to explain, you can ask me.
Ma'am, I had a question regarding muscle cramps which we get. Is
Yeah.
that because of involuntary?
Yeah, this is a good question. Actually, this is abnormal contraction. Muscle cramp is called, there are 2 or 3 abnormal contractions like spasm, cramp, thick twitching, tremors. Have you heard all these like
Yeah.
regular conditions? We regularly experience that. So, cramp is mostly, you are asking about cramp. It is because of overuse or fatigue. fatigue, muscle fatigue. So what happens? Spasmodic contraction, sudden spasmodic contraction because of fatigue, and that is called as cramp. And it is also related with our balance of sodium and potassium in our body. So some of the salts and as I had mentioned about calcium ion, like that sodium, potassium are also salts which are responsible for keeping muscles in relaxed state, and they control this contraction. Not controlling, but yeah, they play role in this procedure. So if water salt imbalance is there, dehydration is there, or muscle fatigue, you're running 20 30 kilo k, like nowadays the people are running, and um, if they are not maintaining water intake properly, hydration is not properly, so this muscle cramp happens. This is called as sudden spasmodic or muscle contraction because of fatigue. Then spasm is also involuntary contraction. Suddenly it happens, muscle spasm. So for example, muscle cramps, muscle spasm, generally we experience in stomach. If stomach is upset, or sometimes gas because of flatulence, that spasmodic contraction of smooth muscles we experience, it's very painful. In menstrual cramps, that is also sudden, menstrual cramps is sudden contraction because of fatigue. This is the difference. Slight difference is there. Right.
So, doctor, I had a query. Like when we hold certain asanas, there is a mild tremor, that trembling thing, that
Yes.
comes up. So, what is the reason for it? Because here we are trying to contract as well. Like some muscles would be contracted, say, Naukasan.
Okay.
That is a time where the maximum trembling after, like, say, 60 seconds hold.
Yeah.
Then I think the body is like, okay, now let go. So, and how do we, okay, so my query is like, why does it happen, one? And how do we overcome it in the long run if we are practicing yoga? Like if we want to hold it for 2 minutes, increase the time duration.
Yeah, it's also a good question, actually common question for yoga sadhaks. Initially, it happens because you are giving stress to your muscles. Much harder work you are expecting from your muscles. So what happens? Each and every muscle made up of muscle fibers. So muscles has their tipping point. So cardiac muscles, we can improve elasticity of muscle, flexibility of muscle, but not suddenly. It needs practice. So now today, if you are practicing Hanumanasana, you are learning Hanumanasana, inner thigh muscles and quadriceps and hamstrings, majoritarily it gets involved. So first day for new practitioner, muscle fibers of inner thigh, quadriceps and hamstrings, their limitation is fixed because earlier in your life you haven't practiced it. So first day they will extend or they will stretch up to their limit. If you will try to cross that limit, what will happen? There are chances of micro injuries in your muscle fibers because their elasticity has limit. So because of that, you are putting hard work, or you are expecting that, and it is generating heat. We start experiencing that tremor, that muscle fibers or muscle tries to tell you that now my limit is over. I can't go beyond that. So stop. So that is called as tipping point. So you need to stop there first day. Then muscle memory is the next step. Now your muscle cells, muscle fibers, they will remember, like yesterday you did this. Now again you will keep on practicing till that limit. Then maybe after 10-20 days, what will happen? Muscles are getting used to of it. They are remembering, muscle memory is there. now slowly that pain starts getting reduced up to that point. At that point, you can then go more, you can stretch more, and you can start then till pain arises. So you should stop there. So like that, slowly, gradually, our muscles with muscle memory, our muscle fibers, they gain that elasticity and they that stretch. So this is muscle tremors while practicing asanas are because of only because of acute stress we are giving to our body, isn't it? Because it's not in our daily routine. We don't sit in Hanumanasana. So when we start practicing, it is new thing for your muscle. Muscle says their memory. So slowly, gradually, tremors disappear. They vanish. So practice is the key.
Similarly, I had a query on Paschimottanasana. Now, I think I probably may have discussed this with you, but just for the benefit of others. Like, when I went into total Paschimottanasana, I could hold it. But after a few seconds, I felt so breathless, I couldn't breathe. And there was severe cramp in the ab, like the diaphragm. I thought I'll nearly get an attack or something. So there you had mentioned about, I think something to do with the contraction, and then if you
Yeah,
can just
so
throw light on
this
that.
is same phenomena. This is happening because of internal abdominal pressure.
Yes.
And this pressure is coming on diaphragm. And then while forward bend, what happens? All internal abdominal organs, their compression is happening. So because of that compression, sometimes areas like near your liver on right side, especially right side cramps are there. Mostly people they experience because liver is a large organ and diaphragm is near that, and because of increasing abdominal pressure, sudden nerves those are supplying to that area, they get irritated and muscle cramp happens. So it is again because of this what we say acute stress and increasing pressure. So suddenly if it is happening, you should lie down, you should stretch, you should do tadasana, so that it will create more space for your liver and internal abdominal organs, and that cramp will disappear. So it is because of internal pressures and sudden neuromuscular connection irritability. It can happen.
Thank you, doctor.
Okay. So I think if there are no questions, we can conclude here. Sir is not there.
Should we give him a call to stop the recording? Because I think he's